Right, so this here is the hip bone, and it is a large irregular bone which is made up of three primary bones, the ilium, the ischium, and the pubis. Now, the hip bone is along with the sacrum, the two hip bones, along with the sacrum and the coccyx, together form the pelvic girdle. Now, the three primary bones which make up the hip bone, as I just said before, are the ilium, the ischium, and the pubis. These are the two views of the hip bone. This is the lateral aspect, and this is the medial aspect of the hip bone. Now, the three bones fuse together at the acetabulum. The acetabulum is a cup-shaped socket which accommodates the head of the femur, just like in the upper limb where the glenoid cavity accommodates the head of the humerus. In the lower limb, the hip joint is composed of a socket and a ball. The socket is formed by the acetabulum, which you can see here, and the ball is the head of the femur. So this acetabulum is composed of all the three bones, the ilium, the ischium, and the pubis. 2/5 of the contribution is by the ilium, 2/5 of the acetabulum is formed by the ischium, and 1/5 is formed by the pubis. So we'll start with the ilium. This here is the ilium. It has two parts. It has two ends. It has an upper end and it has a lower end. The upper widened part of this ilium is known as the alle of the ilium, and the two ends are so the superior end or the upper end makes up the iliac crest, and the lower end takes part in formation of the acetabulum. Now, along with these two ends, the ilium has three borders. So it has an anterior border. The anterior border starts from the iliac crest, which is this part, and a posterior border, which is this one here. And then it also has a medial border, which is this one, which extends from the iliac crest down here to this part known as the iliopubic eminence. Now, the three surfaces are this outer surface, which is known as the gluteal surface, the surface which faces the pelvic cavity, which forms the iliac fossa, and then this surface here is known as the sacropelvic surface. Now let's start with the upper end, which forms the iliac crest. The iliac crests have an anterior part. The anterior 2/3 of this iliac crest forms the ventral 2/3 of this iliac crest, and the posterior or the dorsal 2/3 is this part right here. So this is a view of the iliac crest from the top, right? So this would be the outer side, and this would be the inner surface of the pelvic bone or the hip bone. So this is the iliac crest. This is the anterior end. This would be the posterior end. So this anterior 2/3 is the ventral part, and this posterior 1/3 is the dorsal part of the iliac crest. And the anterior 2/3 can be divided into an outer lip, which has a prominent iliac tubercle, an inner lip, and then this green area represents the intermediate zone. And in the dorsal 1/3 part, you have a central raised ridge, and on either side of that raised ridge, you have a slope. So you have a medial slope and a lateral slope. Now moving on to the two borders of the ileum, you have an anterior border and a posterior border. In fact, the three borders. So you have an anterior border, a posterior border, and then you also have a medial border. Now the anterior border has an anterior superior iliac spine, right? So it's a prominence on the anterior end of the iliac crest, and an anterior inferior iliac spine. And here you will have a posterior superior iliac spine and a posterior inferior iliac spine. Now the anterior border of ileum extends from the iliac crest to the acetabulum. The posterior border extends again from the iliac crest above, and below it forms the upper part of a notch which is known as the greater sciatic notch. Now below that, the continuation is by the ischium, which we'll talk about later. The third border, which we talked about before as well, is this one. This is the medial border of the ileum, and it extends from the iliac crest to the iliopubic eminence here. And this border, medial border, divides the two, out of the three, it divides two surfaces. This one here, which forms the iliac fossa, and then this surface, which is known as the sacropelvic surface. Now in the sacropelvic surface, you have a region known as the iliac tuberosity, and then you have this auricular part here, which actually articulates with the sacrum. The third surface of the ileum is this one here, the external surface. Very easy to see that it is the external or the outer surface, because this is where the acetabulum is located. So this is known as the gluteal surface. And on the gluteal surface, there are three prominent ridges or lines known as the gluteal lines. And these are the anterior gluteal line, the posterior gluteal line here, and this is the inferior gluteal line. After the ileum, we will move on to the pubis. So this is the pubis here and here, and this has a body. So the pubic bone has a body and two rami. The body is located medially, and the two rami project from the body of the pubis laterally. And the two rami are known as the superior and the inferior ramus, right? And the inferior ramus then fuses with the ramus of the ischium here to form the ischiopubic ramus. So the body of the pubis has three surfaces. It has an anterior surface here, right? It has a posterior surface here, and it has a medial surface here. This is also known as the symphysial surface, because this is where the symphysis pubis is present. Right here, you can see a very prominent pubic tubercle, and these are the two rami of the pubis, the superior and the inferior pubic ramus. Now talking about the superior ramus of the pubic bone, it extends from the body of the pubis to the acetabulum. It has three borders and it has three surfaces. The three borders are the superior border, which is also called as the pectineal line or pecten pubis. Then there is the anterior border, which is also called as the obturator crest. And then there is an inferior border here, which forms part of the obturator foramen. Along with the three borders, the superior ramus also has three surfaces. So between the superior border and the anterior border, we have a triangular surface, which is known as the pectineal surface. Between the superior border here and the inferior border, we have the pelvic surface. And between this anterior border and the inferior border, we have the obturator surface. And this obturator surface has the obturator groove. So here would have the obturator groove, and this whole obturator foramen is covered with the obturator membrane, and at the site of this groove there is just a little passageway for the passage of the obturator nerve and the obturator vessels. Right, so now let's move on to the ischium. So this here is the ischium here as well. The ischium forms the postero-inferior part of the hip bone. It has a body, right? A body of the ischium, and it has a ramus. So this is the ramus of the ischium. The ramus, as we talked about before, combines with the ramus of the inferior ramus of the pubic bone and forms the ischiopubic ramus. Now this is the body of the ischium. The body of the ischium has an upper end and it has a lower end. The upper end fuses with the rest of the bones, the ilium and the pubis, to form the acetabulum. This here is the lower end, and the lower end forms this part known as the ischial tuberosity. So the body of the ischium has 3 borders and 3 surfaces. There is the anterior border, which forms a part of the obturator foramen. Then there is a posterior border. The posterior border is actually continuous with the posterior border of the ilium. So it forms the lower part of the greater sciatic notch. It also forms this pointy ischial spine, then the lesser sciatic notch here, and then it also forms the medial part of the ischial tuberosity, the medial border of the ischial tuberosity. And this here would be the lateral border. Since we have 3 borders, we also have 3 surfaces. So between the anterior border and the lateral border, we have the femoral surface. Between the lateral border and the posterior border, we have the dorsal surface here. And between the anterior border and the posterior border here, we have the smooth pelvic surface. So if we talk about the ischial tuberosity, this diagram here represents the ischial tuberosity. This ischial tuberosity is divided by a horizontal ridge into an upper part and a lower part. Now the upper half of the ischial tuberosity is further divided into 2 by an oblique ridge. So this would divide this half into an upper supralateral part and an inframedial part. Now the lower half of the ischial tuberosity is further then divided into 2 parts by a longitudinal ridge. So this would have then an outer part and an inner half. Coming on to the ischiopubic ramus, it has 2 borders, an upper border and a lower border, and it has 2 surfaces, an outer surface and an inner surface. The outer surface is rough and the inner surface is smooth, and it is further divided into 3 parts by the presence of 2 horizontal ridges. So this here is the acetabulum. Now the acetabulum is a cup-shaped socket which accommodates the head of the femur. The head of the femur represents the ball of the ball and socket joint, and the acetabulum is the socket of the ball and socket joint. Now, if we compare it to the upper limb or the shoulder joint, the hip joint is much more stable and stronger, because in the lower limb you do not need as wide a range of motion as you do in the upper limb. So this socket is much deeper and the joint is much more stable. But in the upper limb, the cavity, the glenoid cavity, is much shallower, which leads to a wider range of motion, but also means that that joint is much more liable to dislocate. So this here is the acetabulum, and this would be the margin of the acetabulum. This is the lunate surface, which is the articular surface. Here you have a fossa known as the acetabular fossa, and this part is known as the acetabular notch. So the acetabulum, which is formed by the ilium, the ischium, and the pubis, it is directed laterally, downwards, and forwards. Talking about the obturator foramen now. This is the obturator foramen. It minimizes the mass of the hip bone. At the same time, because this foramen is covered by a membrane known as the obturator membrane, it still allows surface area. It gives surface area for the attachment of various muscles. It's a large foramen. It is oval in males and usually triangular in females. When it comes to the anatomical position of the hip bone, important to remember two things: the anterior superior iliac spine here and the pubic tubercle. These two lie in the same coronal plane. Also, at the same time, the symphysial surface of the pubis is vertical and parallel to the median plane.